Is COVID just a bad flu season, or the Black Death 2.0 and we're all going to die? This is the FluView Pneumonia and Influenza website from the Centers for Disease Control. The scary red line purports to be the percentage of all deaths in the United States each week due to pneumonia and influenza. Notice the scale. It ranges in most years from 6% to 8%, sometimes shooting up to 10, 12, 15%. This is another CDC document, the leading causes of death report. It also purports to count the number of deaths each year due to influenza and pneumonia. It attributes, in 2017, 2% of all deaths in 2017 to pneumonia and influenza. In 2016, 1.9%. Percentages are the same for other years before COVID. Less than a third of the 6 to 8% on the FluView website. These are not the only contradictory numbers that the CDC has. They, in fact, have two different numbers for the number of deaths due to the influenza virus. How many people die from the influenza virus each year? The CDC has a poorly documented model, a theory, that attributes about 55,000 deaths per year to the influenza virus. They also have counts based on death certificates in the data on the FluView website, which purport to count the number of deaths in which influenza, the virus, is listed as a cause of death. The black line in the plot on the right is the level of weekly deaths required by the CDC model. It's over 1,000 per week. It's 55,000 deaths a year. The purple magenta line is the actual data from the FluView website. This is supposedly a count of death certificates that list the influenza virus as a cause of death. It is roughly 8,000 in most years, much, much less than the 55,000 from the CDC's influenza model. There are at least 3 different numbers for pneumonia and influenza deaths used by the CDC. The leading causes of death report gives 55,000 deaths per year prior to COVID. The FluView website and data gives about 188,000 deaths due to pneumonia and influenza, giving the 6 to 8% per year. That's over 3 times the leading causes of death number. It also gives exact counts of deaths attributed or with a cause of death of the influenza virus, typically 8,000 per year. The CDC also has a model for influenza-only deaths, which gives a number of about 55,000 deaths, over 3 times, often 6 or 7 times, the FluView influenza deaths count. There are 3 different numbers. How does this work? On death certificates, there are usually multiple causes of death. Dying is a complex process. One of these, by convention, is assigned to be the underlying cause of death, the root cause of the person's death. The leading causes of death report counts death certificates that list pneumonia or influenza as the underlying cause of death. In contrast, the larger FluView numbers, 188,000, count death certificates that list pneumonia or influenza as a cause of death, often not the underlying cause of death. Well, where do these additional deaths come from for FluView? It's not a small difference. The CDC has put out numbers on their excess deaths site showing weekly deaths broken down by underlying cause of death. The green line on the bottom here of this plot is weekly deaths in which pneumonia and influenza are listed as the underlying cause of death. The dark blue line here is something called chronic lower respiratory disease deaths. These are almost all chronic bronchitis and emphysema. About 9 million Americans suffer from chronic bronchitis. About 3.8 million suffer from emphysema. If you add these two together, you get the light blue cyan numbers here, which are almost the same as the bright red FluView death numbers for pneumonia and influenza. They track each other very, very closely. They're seasonal, as you can see, and they don't deviate until March of 2020. It's extremely likely that what FluView is doing is adding together deaths in which pneumonia and influenza is the underlying cause of death, and basically chronic bronchitis and emphysema deaths, which involve severe degradation of the lungs where you become extremely vulnerable to respiratory infections. And the immediate cause of death for chronic bronchitis and emphysema is often a common cold, a minor infection that would be harmless to most of us. What does this mean for COVID? In April of 2020, CDC put out guidance for filling out death certificates for COVID cases, where they gave very specific directions, shown here, directing doctors and coroners in cases of chronic bronchitis and emphysema. That's what this really means here. In those cases, if COVID is involved, COVID is to be listed as the underlying cause of death, and bronchitis, the chronic bronchitis, and emphysema, unlike in the FluView data, unlike with all other viruses and bacteria in the past or even present, as well as other causes of death, is not even to be listed as a cause of death. It is to be listed as a contributing condition. No other virus has been treated this way ever. No other bacteria. It's a substantial change. What does it mean for COVID? First, it means that the count of COVID deaths almost certainly should be compared to the larger CDC FluView number, the 188,000, or perhaps an even larger number incorporating other leading causes of death, underlying causes of death that are highly seasonal and likely involve viruses and colds and other problems. The CDC presents the leading causes of death in FluView numbers without error bars. They are listed to the last digit. They are strongly implied to be accurate to the last digit. That is not common scientific and engineering practice. How many other numbers that the CDC has or is using or putting out are in fact quite imprecise, like these numbers, and what are the consequences of those numbers, both for COVID and more generally for public health?
This concludes this video presentation. If you like this video, please click like. Please click subscribe and the notification bell if you would like to receive more content from us. You can avoid internet censorship by subscribing directly to our RSS news feed. Please consider sharing the link by email and on your website or blog, in addition to liking, upvoting, or sharing on increasingly censored, advertising beholden, big company social media. We have encountered such censorship. Mathematical software is developing algorithms and software to automate data analysis, reducing the risks of costly errors and increasing the predictive power of the results. You can support our work financially by subscribing on our Patreon page, https://www.patreon.com/mathsoft, or scanning the QR code in the lower right corner. Our previous videos and articles on the contradictory numbers on the CDC website have repeatedly been censored by a range of social media services, such as LinkedIn here. This was a few weeks ago. This is the actual post that was censored. We've run into this with a number of different platforms. It's rather concerning, especially considering that these posts are pointing out contradictory data on the official CDC websites and documents. Apparently, it is a real threat to the society, democracy, human lives to point out obvious, gross discrepancies on government websites. You can bypass this censorship with our censored search website and service, which you can reach at censored-search.net or censored-search.com or censored-search.org. We may add additional names later, but those are the names right now. It's censored-search. Find the answers to your problems censored by advertisers and other powerful interests. It is free. We have a free version, which ranks the search results according to popularity. That is how many other websites link to the page, the search result. You can also pay and get more control and transparency into the algorithms. You can get access to more advanced artificial intelligence algorithms that look through the censored content and try to identify pages that are censored because they contain factual, true information, and separate those out from other ones which are not so useful. A popularity contest cannot always do that correctly, and popularity contests can be manipulated in various ways. Thus, check out censoredsearch.com, censored-search.net, censored-search.org.